you both for joining me this evening. And we are literally talking shit. So, welcome to Margaret. Welcome to Sarah. We're all part of the group in Nourish, which is Nourish to Flourish. And I believe we're in week 5 this week in Nourish. And every week we're sharing information with each other. This week, we're talking about, the essentials of bowel movements and actually health and fitness and wellness. Because, at the end of the day, our digestive system might start in our mouth, but it also finishes down the other end. And as much as people don't like to talk about it, because I've had health issues, I'm very aware that my gut health reflects everywhere. It reflects in my skin. It reflects in my irritability or good humor. It's everything. So, today, obviously, and I said, well, we're talking shit, but realistically, we're talking deep gut health. So, who wants to jump right in? Knee deep.
But I think the thing is like you were saying, that's something that most people don't want to talk about. It's like, I don't know where we became ashamed of the fact that we have it. Everybody has it. And if you're not having it, we need to talk because you need to be having it.
Yeah. Yeah.
But there became such a shame and a stigma around it. And, and it's one of those, I raised my children up to be aware of it, So we will literally have talks about that. The first question that comes out of my mouth when their stomach is sore, is like, have you had a bowel movement? Have you pooped? And now they're just at the point, they just answer now. And they're like, my stomach hurts. And yes, Mom, I pooped. Yeah. It's just skip to it, but then it goes.
But around. I mean, when a child's a baby, when you think about a new mother and a new parent, all you talk about for the first 6 to 8 months is poop.
Right.
Let's be real. With a newborn, you talk about it.
And what do doctors always ask you about when you go in with them? What did it look like? What did it have an odor? But we forget that still needs to carry on even into your adulthood. It needs to carry on for the rest of your life. Turn around and look at it. You need to know what is happening.
Yeah, it tells you a lot about what's going on in your life, definitely. Just from the nutrient density of the food that you're eating to whether or not you've got an infection going on somewhere in your body, poop speaks volumes. It really does.
Yeah, absolutely. Yeah. And one of the things that, I had celiac disease. And the worst thing that happened to me was that it became horribly smelly. And, I lived in shame. I didn't leave the office. I had an office that literally had an ensuite. And I didn't want people to walk into my office even because I wasn't sure if the smell from the ensuite was going to come out, that sort of thing. And it was, you live in shame. You live in this fear of, oh my God, somebody's going to know how bad this is. Right. And, go out to dinner. I might go out for lunch, but I would never go out for dinner, it was just, and you live this reclusive life because you're not well.
Yeah, I was having a little gastrointestinal distress yesterday, and it was a beautiful day, and I wanted to take my dog for a walk, but I knew I couldn't go far from home because I had to be nearby. But yeah, I don't know when it became such an embarrassing topic to discuss. There's even a children's book out there called Everybody Poops. So we should be teaching our kids from an early age that that's what we do and teach them what a healthy poop looks like.
Tony Lee says that she's been drinking a ton of kale juice. So things are smelling pretty nutrient dense coming out. And she's read the book.
It's a great book. It's for all ages. Oh,
Absolutely,
well,
yeah.
the smell, the primary smell that we get is from bacteria and parasites. That's what we're smelling.
Oh, absolutely. And I could tell, I mean, like, just once I started really taking care of my gut flora, you know, and getting back to health, I could tell just from the smell I was getting back to health. You automatically know of, okay, this is what it's supposed to be like. And, you know, it's a lot of work to get healthy when you've had, I mean, my gut was destroyed. Too much antibiotics, you know, they because unfortunately I live in a country where there's not a lot of Anglo-Saxons, they were really unaware of celiac disease. So as far as they was concerned, I had gastritis and I had irritable bowel syndrome. So I got way more antibiotics than I probably ever needed. And I completely decimated my good gut flora. It took me years to build that back. But, you know, on top of that, because of the celiac, you're not absorbing nutrients. What's going through you is fermenting.
Yeah.
You know, nobody talks about, you know, food fermenting in your gut, but
yeah,
it happens, you know. And so when you start to recognize what health looks and smells like, then you can make changes. But as long as you're living in this bubble of let's not talk about it, I mean, and not talking to your doctor about it, which is the worst part, because I was even ashamed to talk to my doctors about it.
And it seems like they don't really want to bring it up either. You know, they might check on your sheet, say, oh, you're having, you know, regular bowel movements. Okay. And move on and never ask about the quality of them. And there's so much information there.
Right.
Well, and I know for me, the only doctor I ever talked to about my whole real problem was a naturopath doctor, because even the gastro specialist was just like, we'll take these pills. And I was like, aren't you going to do like any tests? Aren't you? I mean, you know, oh no, you've got irritable bowel syndrome. I mean, you're just in a high stress job.
And it's funny you said that, because my daughter, when she was little, she had a lot of kidney problems, but she also, along with that, had gastrointestinal disorders. So seeing the internist, it was amazing how, you know, they just wanted to know how many bowel movements she was having, not the quality or the quantity or anything like that. And then I was, because she suffers from kidney problems, she also suffers from severe constipation. And it was that, take some pills and here you go. Okay, this is a 2-year-old. You know, let's automatically just fill in with pills, and, you know, shouldn't we be finding out why and how we can do this? And like you said, it wasn't until we got to a naturopath that just said, oh my gosh, stop.
Yeah.
Here, let's literally dig into this. And she's like, bring me a sample. Let's dig into this.
And that's the most frustrating part. The gastro didn't even ask for a sample.
And you know what is, you know, a little aside here, every year when I take my dog to the vet, I bring a stool sample with me because they check it for bacteria and parasites. Yeah. Well, we don't. But
you do that for your dog.
Yeah.
I mean, I've done it for dogs. I've done it for cats, of course. Yeah. You know, it's one of the first things that, you know, if your dog is sick, especially if they're vomiting, the first thing they ask us is if you've got a stool sample. Why? You know, so yeah, for me, it's like, this is all about your health.
Right. Yeah. And even when, like, you don't understand is even the things that you eat and taste are going to be different depending upon how well your intestines are working. If you're not having normal, regular bowel movements, you're not going to taste things as well as they need to be tasted. You know, if you are having a system that's running, and people are always amazed when you say you should be going 3, 4, and 5 times a day, you know, healthy, solid, almost toothpaste consistency movements. And that is like the epitome of health. That's where you want to be at. And people are like, I poop like once every 3 days. Okay, well, you need to work
on you're lacking fiber big time. I mean, you know, just add, you know, worst case scenario, add some psyllium to your diet. You know, if you're not going to eat
water,
vegetables, you know,
you can't underestimate the amount of water that you need. It's just like if your stools are too loose, you need less fluids, right?
Yeah.
And you need a binding agent. Like for me yesterday, since I was having some trouble, I ate white rice all day yesterday
Of
because
course.
it's binding.
Well, and the
So,
funny thing is psyllium is another one of those. It's an binding. If you are not going, take psyllium. It'll help you go as long as you follow it up with water.
Yeah.
If
water.
you are going too much, you need psyllium to bind you and slow it down a little bit. And it's
Which is and that's what works for me. I take psyllium every single day to bind it
right.
because of the celiac. It just, my body was shooting food through, like
Right.
I would eat now and in 3 hours time, I would literally, excuse the language, shit what I'd ate and the lettuce would come out whole.
Right.
Yeah. And just for anybody who's wondering, a normal bowel movement from the time you eat something to the time that you excrete it should be anywhere between 24 and 72 hours. So that's about how long it should take.
Completely digested. Exactly. You there shouldn't be any,
right. Shouldn't be able to recognize your food source on the when it's on its way.
Right.
Exactly. Okay. And I lived for years recognizing my food sources. Mm-hmm. Now, what I started doing was eliminating those specific ones from my diet because I recognized that it was just totally hurting my body. And it was like, okay, and so I had a couple of years where there was no lettuce, no tomato, because just could not digest it. I was like, okay, so none of that. I'm back to eating that now, but it took me years.
Right.
Yeah. Well, your gut health is improving, so you're able to absorb the nutrients and process the food properly. So
absolutely, yeah. So I mean, but and people, one of the things I had to give up, and I gave up for years, was coffee. And people are like, well, why? I was like, well, because it's a diuretic, And for me, that was hard. Giving up coffee, that was one of my that's one of my loves. It's still one of my loves, but I measure now how much I allow myself to have because I know it's not, for my gut health, that's not, my head loves coffee. My gut, not so much.
Let's be honest, nobody's gut loves coffee. If we're really just talking digestive health, not a love right there. But that's just it. And it's learning to take that control. You learn how to work with your body instead of against your body. And I think that's where the big difference comes in. Learning to work with your body. It gave you the signals and the signs and said, this isn't working, Beth. We've got to change something. And you finally said, I'm listening. Okay, we're going to change this and I'll work with you now.
Yeah. Well, it's educating yourself about what normal is and then recognizing if you are straying far from normal and then learning what to do to get back on course. That's
and so for some people that might just be short term of, they got food poisoning or whatever. And so it's not for 3 or 4 days. But, if you're suffering from this chronically, consistently, there's probably something to look for. Your body, and I mean, the acronym PAIN, please acknowledge information now. If your body is not processing your food properly, acknowledge the information. It's all information for you. It's not for somebody else.
And I think it's important too, like in that conversation right there, people to start keeping track. If you're in poor health, you get to be your own detective. You get to take that control. I think we somehow just let these doctors and nurse practitioners and whomever all of a sudden become that advocate for us. And it's like, they're not, they're just, they're here to serve us. And we forget that. But we need to come with that information and we need to be armed and educated and say, okay, I need you to take this further, but this is what's happening. And if you are keeping track of what you eat, what your reaction is, you honestly are your best advocate right there, because the doctor will probably tell you, hey, you know what signs these are looking at, Beth? This is where we're starting to point now.
Exactly.
Yeah.
And that's just it. I'm not saying use Google as your doctor. Without a doubt, absolutely not. Go to a professional.
Right.
But at the same time, I know that the more information you give them, the better able they are to do their job. And, one of my biggest disappointments with myself was that I wish that I had known in 2003 what I know now in terms of my health and my gut and what to look for. And that I had the guts to tell my doctor, no, I'm really sick. Keep looking. Just don't blow me off. I wish I'd said to him, no, the pills you're giving me, that's just a placebo. And I didn't have the guts to say that to him. I didn't have the guts to say
that. Sorry. There's a funny thing about when we go to the doctor, especially after you've established a relationship with one, you want to show up and be a good patient. You want to get good grades from your doctor. So, you don't want to be bringing all this trouble. You just want to be good. And that's not what you're going there for. You're going there to really dig into what is malfunctioning in your body and where there is sickness and where you can do healing. And it's so important and I've learned this over the years and the hard way, not to just accept that there's a pill that you can take that is going to mitigate the symptoms and make the symptoms go away without ever really getting to the source of the illness. And that's what we need to get to if we want to have long-term good health.
Absolutely. Yeah. I worked for a naturopath, and I'll tell you what, the one thing he used to tell all the patients that came in was, if your doctor's not listening to you, then you need a new doctor.
Yeah.
You need a new doctor, because that's what they're there for.
Absolutely. And the mistake I made was not telling my doctor of, wait a minute. I accept that you think, looking at this, that, oh, this is easy. That's what it is. But, 30 days later, I stopped taking the pills and I didn't go back to the doctor.
Yeah.
And
there are times when you're having really acute symptoms where maybe they do have to intervene and treat you with something that's going to stop things so that then you can reset and get back on track. But, it really is all about being your own advocate and speaking up for yourself, really just finding your voice and saying, yes, I tried that and it didn't work, or even trusting your own bodily intuition for what you think might be going on in your body. That's what I'm working with my naturopath on right now. It's like I had this huge intuitive hit about what I think is going on in my microbiome that I can kick the hell out of my body and start healing. And she got right on board with it. And she was able to take me further than just my intuitive hit. But we were definitely on the same page. And so there was a medical background and protocol for me to follow, which I couldn't have figured out on my own.
Yeah. Tony Lee says she was an annoying patient who showed up well researched. I told my doctor what I had. He told me the chances were 5 in a million. I told him I knew what I had and insisted on getting testing. And guess what? I had what I told him I had, and I know for me with celiac, I found celiac on the internet about 5 years before I got diagnosed with it. And I never took that back to the doctor. And I always had that sitting there of, well, this could be celiac.
So how long did it take them to diagnose you?
Well, guess who diagnosed me?
Well,
my gynecologist.
Well, there you go.
Right. Yeah. Well, I mean, and so who sent me for the right tests was my gynecologist. But he was the one that said, tell me everything that's going on in your life. And he's the one that sat down and said, I want to know your entire medical history, not just the female part. I want to know the whole body part. There's so much going on here. Right. And because I'd been diagnosed with insulin resistance, and he was like, you don't fit the type. There's something else going on. And of course, once he got the celiac, he's like, there's no insulin resistance. This is celiac. Causes insulin resistance, but that's not what the big problem is. So, and it's just, but it's finding that doctor who's going to listen to you and insisting until you get the doctor that does.
Right. And I'll tell you, there's another way that you can start doing these things. If you have a doctor and you're still going through these things and you are just really, not ready to maybe find another doctor, you can do something as simple as go in for allergy testing, food allergy testing. Because let me tell you, you want to have your eyes opened up, you will have your eyes opened up, and you want one that's going to run a full spectrum, wheat, dairy, spices, all that, just things.
Well, I found out I was allergic when they did the celiac. I'm allergic to bananas, of all things. I used to eat a banana every single day. That was my go-to pickup every morning.
But it's amazing because they give you, when you have a food allergy test done, because again, it can tell you so much about what you're also outputting or why you're outputting that. Because when I worked at this office, you'd be surprised, people come back and they were allergic to black pepper.
Yeah.
They would be allergic to, just like you said, bananas, everyday things that you eat, but they would tell you your range of allergy to it. And they're saying you can omit this. If you're maybe at a 1 or a 2, you can omit it for, 6 months or so, and then slowly introduce it back in and you could be fine.
Yeah, exactly.
But when you are at range 3 or 4, you're done. You don't get to go back to it. You're done. That's it. There is no reset for it.
Yeah, for years I thought I had IBS, and that was what I had been diagnosed with when I lived in the Midwest. And when I moved to Washington, the first thing I did when I got here was find a naturopath. And then the second thing we did was a food allergy panel. And I found out that I'm allergic to dairy, to casein, to yogurt, to eggs, and to chicken, and all of these things that I love to eat, being from the Midwest. And I had to cut them out. I about cried. Well, I think I might have actually cried when I had to stop eating cheese.
Right.
But then after I did it, and my body didn't have to try to process something that it was allergic to, guess what? I never had IBS. I had an allergic reaction to something that I was eating on a regular basis.
Right. Yeah. And that's it. IBS is just a broad spectrum term to cover the reasons. They don't know why it's happening. Yeah. But we need to give you a diagnosis so we can send it into the insurance company and classify you with something. And that's just, I'm being completely honest with you. That's why IBS exists. It is just a broad spectrum. I don't know what's happening with you, but we have to give it a label so we can bill your insurance company. Yeah. And we'll move forward from there. But it is, again, when you have something like that, be your own advocate and do your research and find out, is it food allergies? Is it just you're having a reaction to something? People don't realize that your bowels will also tell you what's going on from things that you're applying to your skin. Maybe you have a lotion that your body is just not able to handle, and it is causing this adverse effect in your gut. So people are like, what? My lotion? But if you have a highly chemically laden, and I hate to do this, but Bath and Body Works is highly chemical shitstorm. It really is. It smells wonderful, and I know it does, but it is horrible for you. Horrible. But it can actually cause adverse effects in your gut. Lip balms, makeup, hair supplies. I mean, all these things.
Well, I mean, we have to remember our skin is the largest organ. It's the largest surface area for absorption. And so, if nothing else, what are you treating your skin with?
Right.
How kind are you being to your skin?
Just if you start literally from the outside and work your way in, you will probably figure it out before the doctor's tests come back through, or that you finally get one to test you. But just by literally starting to take that personal inventory, what am I putting on? What am I using? What lip balm am I using that maybe as you're licking your lips, are you ingesting something that you're allergic to? Yeah. If you really just start breaking these things down and becoming so more aware, your body's telling you, and your body's going to tell you when you got it right too, because it's going to settle down and you'll find that homeostasis again. And your body's going to be like, okay, let's go. You've got energy. You feel good. You look good. And we don't realize we even smell better, because when your bowels aren't acting properly, your skin is also emitting it.
Right.
Yeah. And I mean, and another thing is, if you've got constant bad breath, we're talking ends here, if you've got constant bad breath, it might not be a dental problem. It can be from your stomach,
Right.
and people aren't even aware of that, and so, they're walking around with bad breath. They're using breath freshener. They're brushing their teeth constantly. And that's not the issue. Their
Right.
digestive system is trying to provide them with a message of, I'm not doing okay here. Can we change something?
Right. And unfortunately, when they're going through that, and what else are they doing? Most of the time, those people, they're stuffing their faces with breath mints to cover it, which is also increasing the problem in their digestive system.
Exactly. Yeah.
And they just, they're trying their best. They're trying to do, they don't want to be offensive, but it's just like, so they're even adding more into it. And it's just like this really bad cycle that has to find an end.
Yeah. Yeah.
And I would say if you are thinking about asking your doctor to do a food allergy panel on you, to request one that is a blood test, so that you do an IgG and an IgA testing rather than the skin prick and scratch test, because you're not going to get the same results. But in testing your blood, that's where they can test for all different kinds of food, and then they can do a separate spice panel too, because you can be allergic to spices. I'm allergic to sage.
What?
Oh,
yeah.
Wow.
Yeah.
Oh my goodness. Okay. Yeah. And that's just it. We have no idea. When I found out I was celiac, it was like, oh, well, that's gluten. But it didn't end there. I was like, bananas. Who on earth is allergic to bananas? And luckily I was at a 1, and I went off bananas for about 2 years. And then I started with organic bananas, and no problem.
Perfect.
Because the most probably my allergy was not actually to the bananas, but to the pesticides that they spray on heavily in Panama on the plantain,
and whatever mutation that's causing in the banana that you were creating a histamine effect to in your body. That's what was
exactly.
going on.
So since then, I don't eat a lot of them. I wouldn't dare go back to having a banana a day, because I'm just not going to risk that, but I can enjoy them now. Without any problem. I cannot, however, go back to egg yolk. So, that's one of my things of, not because I really miss egg yolks. I miss, that lemon meringue pie that you use the egg yolks to make. I miss that.
Is it just chicken eggs? Have you tried any other kind of eggs, like quail eggs or some other egg?
That never occurred to me. No.
Yes, I know.
That's what our naturopath used to recommend. If I had a chicken egg allergy, which I still do, but they would recommend, if you still want to eat eggs, try several other types.
I don't need to eat eggs, but I'd like to be able to make lemon meringue cake, lemon meringue pie.
Duck eggs are another good one for people who have chicken egg allergies. Duck eggs are usually more digestible.
Oh, okay.
But you're right, because even as a vegan, they don't make anything really good as a meringue. Sorry.
No, not really.
Yeah. It's the only
try
thing
aquafaba.
It's the only thing I really miss. Yeah. A good lemon meringue pie, there's just nothing like it.
Okay, so let's talk about this. What about when you have a really excellent bowel movement? And
you mean like the dog does, and then he
so
just
good.
takes to running around the yard.
My dog does that all the time. He runs like,
yes, I did it. Yeah.
But there's something physiological going on there. It's like a poophoria that you get, and it's an actual, your vagus nerve, if you have a really, really fantastic bowel movement, your vagus nerve gets stimulated, and so you get that euphoric sense after having a really good poop.
Well, guys tend to talk about that more than women do. Like a guy will walk out of the bathroom and go, man, I just had the best dump ever. And I was like, too much information. But, they're still, in a way, connected to that, possibly more so than we as women are.
Yeah.
Yeah. Well, physiologically, we're different. We're constructed differently.
Well, but I'm saying, like, I get what she's saying is like a guy will have no problem. Here's a good example. I was just talking about this with my daughter. We went to Walmart and was doing shopping and had to use the restroom. There was literally a woman who was in the process of going and having a bowel movement and stopped when I walked into the bathroom.
Oh.
You could hear her, I mean, just miserable, like waiting for me to hurry up and leave. And I'm just like, hey, just go. Just go.
Yeah.
If we're using a public bathroom, you have to go. I get it. Just go. We all go. But you know, when we started talking about it, it was just like, guys, they don't have a problem. They'll go into the public bathroom and they're just like, oh, you might want to wait a minute, and then they just keep going. No problem. You know, women are in there, you know, just holding back, and they're just like, I don't even want to make a sound when I'm going to, you know, have urinating in the toilet. It's like, oh, I don't want to make a noise. I'm like, oh my gosh, where did we go wrong?
Yeah,
you know,
how did we get to that point?
But we need to be more like that with, you know, whereas the guys are happily, excitedly telling you like, man, I just had the best poop ever. Okay.
Yeah.
We should be celebrating that, because guess what? Your digestive system is working great. You should celebrate that.
Yeah. Yeah.
I'm all for it.
No, and that's just it. You know, I mean, for me now, it's this recognition that my bowel movement is a symbol and a thing that tells me how my health is doing. And, you know, it's supposed to be easy. It's supposed to be, you know, continue consistent, you know, as in twice a day, 3 times a day. And, you know, if you're only doing it once a day, and sometimes it's once every 2 days, that's a problem. That is not the way it's supposed to be, you know? And so for people just to become aware of, okay, you know, they're not supposed to float. They're supposed to sink.
Yeah.
If they're floating, there's too much fat in your diet. You
or
know?
gas. It can be caused by gas. Yeah.
And for me, yeah, absolutely. I had, you know, 2 or 3 years where I had to flush twice or 3 times because I had such gassy bowels. It was just like, oh my God, it's never going to go down.
Yeah.
But until you've been there and you've suffered through that and you get, oh, you know, I don't care. I'll just talk about my shit, you know? But most people don't realize, you know, what does good shit look like? You know, what color should it be? And the other thing, if you eat beets, your shit will go bright red. Yeah. Don't freak out and call your mother.
Yeah.
Right. No need for an ambulance. Just remember you ate beets. It's okay.
Exactly. Yeah.
But that's just it. So what do you ladies do to ensure that you are having a good bowel movement? And what would you suggest that maybe somebody else could do?
Well, without sounding too, you know, textbooky, well, eat your veggies, you know, definitely eat the greens and the fruit. You need the fiber, you need the volume also of that fiber, you know, and that's the whole thing with salads is that, you know, you can eat more salad, you get more nutrients from it, and you'll get more fiber for your bowels. Your bowel will be happy with that, you know. But you know, I make it up.
But
I make it up.
I'm going to stop you for 1 second. That's a great point right there about the volume of a salad, because we talk a lot about juicing and how important juicing is, and people don't understand, even though you are consuming a large amount of vegetables and fruits, it can actually constipate you.
Yeah. Because you're not getting any fiber.
You don't have that volume to pass it through. So I think
exactly.
I just really wanted to highlight that point so it's not lost in the conversation that volume is really needed.
Yeah, because I mean, it's wonderful to juice in the morning and have that concentrate of that powerful drink first thing. But that cannot be the only vegetables or fruit of the day because you're not getting enough fiber from it.
Yeah. And fiber is our friend. It goes through
Oh,
and it just sort of
absolutely.
cleans and scrubs the walls of your intestines, and
And also
you want it
find
to do
out
its
what your
work.
body likes with fibers, because
Yeah.
like I love oats, but I have to be really careful with them. One, they have to be gluten free, but secondly, how much, and for me as a woman, which time of the month. There's times, like when I'm heading into PMS and period, it ain't happening. But just getting to know your body, what's working for you, what's not.
Yeah.
So Sarah, what do you do for keeping those healthy moving bowel movements moving and chugging along?
I have been really fortunate my whole life. I've never had trouble. I'm really regular, like 9:30 every morning. You can pretty much find me right in the bathroom. I mean, you can almost set your clock by it. When I switched to a plant-based diet a couple of years ago, then I started going twice a day. So, for me, it's all of that, the plant fiber you get, the cellulose from all of the plant fiber that is what really passes through your system because it's not digestible. And I drink water as my primary beverage.
Yes,
I rarely,
absolutely.
like, I'll get up and drink, I admit, I'll have 2 cups of coffee in the morning, little K cups, so I don't think they really count. And then I drink water all the rest of the day, all day long. So I think that's helped me a lot. But even within families, you can have vast differences. My sister and I are complete opposites. Like, she has bathroom envy of me because she can only get there like every 3 to 4 days.
Wow.
And she's plant-based. And she takes Metamucil every day. Sorry, I'm telling my sister secrets in open air, but I don't think she would mind. And still her body doesn't process the same way that mine does. I have a very efficient system that way. And she doesn't. So I haven't figured out the trick for her, except that maybe she needs to add more water.
Yeah.
And another trick too is movement. People underestimate, as we're in
absolutely exercise and walking. Yeah.
If you are not moving, your bowels aren't either. So they're going to slow down to the pace of what you're moving. The more active you are, the better health your bowels are in. So
absolutely,
you can eat all the salad and you can drink all the water, but you've got to move to get things moving.
Yeah,
so
absolutely.
We're such a society now that is so sedentary that we forget that just getting up and going for a walk is going to make a huge impact in your overall health.
Absolutely. Yeah. Well, ladies, this has been fabulous. Thank you so much for coming to talk shit with me. It's been fun, and I hope that it's also given other people just that opportunity to recognize that this is something you need to talk about. Not just you can talk about, but you need to talk about it, especially if it's not going the way you think it should be going. If it doesn't feel right, if it's uncomfortable constantly, if it's gassy, if it's if those are things to definitely talk to your doctor about, and talk to them until you get a solution, until you find yourself in good health again, not just once. I wish I hadn't been embarrassed to talk to my doctors about it, because I'd gotten solution so much earlier.
Yeah, well, hopefully, now just with forums like this, with people out here talking about it, maybe we'll encourage that one person who's been really reticent to say anything to their doctor, and we'll give them the courage to speak up and seek their own health.
Yeah, absolutely. I think that's
thank you guys so much, and we will see you all next week.